Hey everyone, this is Dr. Tom with Peachtree Plastic Surgery, and today I want to talk to you about liposuction. All the different kinds of liposuction that we can do, what we mean, how it works, that kind of thing, and what the results you can expect from liposuction are. We'll go through the different energy modalities and how we've adapted liposuction over time, and how we perform it today, and how it's different from with the past, and the various things we can do with it. So, liposuction. You've all heard about liposuction. This is not an uncommon procedure. It's actually one of the most common plastic surgery procedures that we perform in all of America. The basics of liposuction are pretty simple. We have a hollow metal tube that we apply suction to and run it through the fat in the body, and we remove the fat from the body. It was invented a very long time ago by an Italian OB-GYN, and we've since adapted, come a long way. When liposuction started, the first people to do liposuction had tremendous amounts of blood loss. As a matter of fact, most patients who got liposuction when it first started needed a blood transfusion because it was so bloody. Then a dermatologist named Klein figured out that if you infuse a lidocaine and epinephrine solution into the fat before performing liposuction, you can prevent a lot of the blood loss by clamping down on the blood vessels through the use of epinephrine, which is commonly known as adrenaline. A little later in the early 2000s, we invented power-assisted liposuction. Power-assisted liposuction is basically adding a motorized oscillator that vibrates the liposuction cannula a great number of times per minute, and what that does is that allows us to go through the fat easier. It helps with surgeon fatigue, and it helps us remove more fat at a time. So that's the basics of liposuction and kind of where we're at now. So what do we use liposuction for? Well, this is pretty obvious, right? Anywhere there's fat, we can remove it. In my mind, it's not to remove fat. It's a tool that we use as plastic surgeons to remove volume, to create shape. So liposuction is just it's equivalent to a chisel that a sculptor would have used in the past to remove pieces of a statue or of a brick or of a block of marble. We want to create a shape with a goal in mind, a shape in mind, and liposuction is how we remove volume. Now, fat transfer is how we add that volume back, which is equivalent to a clay maker adding clay to a statue before they put it in the kiln. But it's a tool to create the shape that we have in our mind and the shape that we've come up with the patient. So any area of the body can be liposuction pretty much where there's fat. We can liposuction pretty much any area of the body that there's fat on, and frequently we'll liposuction the entire body for a large liposuction case. We'll use a smaller cannula on an area like the arm, as opposed to an area like the belly where there's lots of fat. But we can do these things to create the ideal body based on what the patient wants, to achieve the patient's vision of their ideal body, whatever shape that may be. Some more modern innovations in liposuction, there's new devices and new technologies that we've added on to the liposuction cannula, and I'm going to go through a couple of them with you. The first one I want to talk about is smart lipo, so-called smart lipo. Smart lipo is the cannula that we use to liposuction. We add a laser onto the end of it, and what that does is that it heats the tissue as you go through it with the laser. And what the heating of the tissue does is it causes collagen to contract. Now, collagen is what makes up our skin, and I'm sure you've heard it, and you may even have taken collagen supplements before. But collagen is a protein molecule that when you apply heat to it, it contracts. And so the thought is, well, while we remove the fat, why don't we apply heat to the underside of the skin and to the connective tissue underneath and within the fat to cause it to contract, and you get additional skin tightening. And that idea of heating and applying energy to the subcutaneous tissues and to the dermis while we're performing reduction of fat is the basis behind a lot of these new technologies. A vaser is a similar principle where we apply an ultrasound probe to the end of a liposuction cannula. The ultrasound probe delivers ultrasonic energy to the subcutaneous tissues and to the connective tissue of the body and to the underside of the dermis, causing contraction. J-plasma is a similar technique that uses helium plasma. The one that has the most data about it is the ThermiTight, which is a bipolar radio frequency cannula. What that means is it's a device that's kind of shaped like a U, with one part that goes on top and one part that goes under the body. And as you slowly withdraw in between the U, radio frequency is emitted, which heats all the tissue in between the clamps of the U. And you can withdraw it. That causes, again, the same thing we've talked about. It causes energy, and when you deliver energy to collagen and to the basement membrane of skin, you cause it to contract. And that contraction gives you skin tightening as well as volume reduction. Now, what does the evidence say for these technologies? There was a large study done in 2016 that looked at traditional liposuction compared to a Vaser, which is the ultrasound liposuction. And they found that the Vaser group had 17% skin contraction versus 11% with the traditional liposuction. So traditional liposuction, the act of running a cannula through subcutaneous fat, actually also causes contraction. We believe that when you remove the fat cells, the collagen that is stretched out because of the actual adipose tissue, the fat tissue that we're taking out, it's no longer like a full balloon. It's like removing water from a water balloon. It'll shrink down. And that's what the skin does naturally, even when you don't apply any energy to it. So we saw 11% contraction with just using liposuction alone. But there was more contraction when we also added a Vaser. Now in that particular study, what they found is that there was additional sharp pain. There was a risk of burns, although none of the study participants were burned. And so there were various other trade-offs using that technology. There was another study that was done on the abdomen comparing traditional liposuction to body tight, which is the bipolar radiofrequency that we talked about. And they found that there was a very large difference in the amount of contraction that you got in the skin when you compared it to traditional liposuction. But the method with which they used and performed liposuction is different than how a lot of other people perform it. So the advancements in traditional liposuction include a technique that I personally like to use called safe liposuction. And SAFE is an acronym. All liposuction is very safe when performed by a board-certified or board-eligible plastic surgeon. However, the term safe liposuction is an acronym for separation, aspiration, and fat equalization. And it's a 4-step process for performing liposuction that gives you what I believe and what many people believe is a better result. Now, safe liposuction was invented by Simeon Wall, and it was published on this, and he is a plastic surgeon out of Louisiana, where basically the first step is tumescence, like we talked about, to prevent the bleeding. And then you perform, instead of immediately going to suction the fat out, you use the cannula to break the fat apart, creating an even liquid layer of fat across all the areas you're going to treat. And then once the fat is successfully broken up, you use a different cannula, one that's a little less aggressive and less traumatic, to suction the fat out until you're happy with the volume. And then in the 4th step, you go back through and redistribute the remaining fat. Again, liquefying what's remaining and allowing it to separate across the entire area you've treated. And this prevents contour irregularities, which you used to see a lot more of in liposuction of the past. You can usually tell when someone's had liposuction on their belly. It can be really obvious sometimes. The study looking at body tight didn't compare that to safe liposuction. It was more traditional liposuction, and people, and myself included, believe that when you perform safe liposuction, you do get additional contraction over performing traditional 2-step liposuction with tumescence and aspiration. Regardless, they're all appropriate technologies. They're great technologies. I do believe there is additional contraction when you apply energy to the end of a liposuction cannula through Vaser, J-plasma, or body tight. All right, well, I hope this shed some light on liposuction. It's one of my favorite procedures. I love to do it because it completely transforms a person's body immediately. And as anybody who's ever known a surgeon knows, we are all about immediate gratification, which if you ever meet one of us, you'll fully understand that, especially plastic surgeons. Of course, I'm generalizing, but I love immediate gratification just as much as everyone else does. So, I hope you enjoyed this video. I hope you learned a little something about liposuction. It's a great procedure. If you have any questions, you can find me all over the internet. I am on Instagram at Dr. Thomas Hagopian. I am on Reddit at Dr. Tom PS, and I am on YouTube at Dr. Tom Hagopian on YouTube. Please feel free to reach out to me in any of these channels. I control my own social media. I will answer your question as quickly as I can. And if you enjoyed this video, please click the like and subscribe button down here. All right, take care.